So, Stephen, tell me about him.
He's CP, visits every 10 working days. It's a bit odd, I'm not really sure what to do. Mum's engaging really well. The house is much better. Stephen's school attendance is a little better, but still not great.
Okay, tell me a bit more.
His attendance has gone up from 60% to 82% last term. Mum's always there. The house looks all right.
Okay, what are you worried about?
Dad is sofa surfing, and his new partner's pregnant. And he hit her when they were in town last weekend. He's still using, but he goes to his drug appointments, and they're pleased with him.
Sounds like a mixed picture. What matters to Stephen? What are his personal outcomes?
He likes to see his dad. He goes to visit his paternal nan and sees his dad sometimes then.
On their own or with a nan?
On their own.
What do you think about that?
I'm not sure. I've asked Stephen about it and he says everything's fine. Mum doesn't seem to be worried and I can't reach Nan to ask her.
Would Stephen tell anyone if he was frightened when he was in contact with his dad?
I don't know. He knows why we're involved and he knows his dad is a drug user. But he loves him and so I don't know that I know enough about the situation to be able to say that he would or wouldn't say.
That sounds like something you may need to find out more about.
Yes.
Okay, so there's an action there. How will you go about it?
First, I want to speak to Mum and Nan. I wonder if we should think about asking Nan to supervise contact at the moment, although I am a bit worried about Dad assaulting her. If she carries on not answering my calls, I'll have to go round to the house, and I'll try and get hold of Dad as well. Although he is a bit more difficult to track down. I could go to the drug service to see him.
And what direct work will be undertaken with Stephen? What safety plan will be put in place if he feels unsafe with Dad?
I'll explore contact with Stephen and talk to him about what he could do if he ever feels unsafe. Maybe there's a member of the family he could call. But given his age, he'll probably still try and have contact with his dad anyway, so it's a good idea to explore a safety plan.
Okay, that's a good idea. What about the next CP conference?
Well, at this point, I think I have to recommend continued registration, even though he's been on the register for 2 years.
Go on. What specifically concerns you?
Mum's doing well, but she hasn't come to the last 6 core group meetings. I asked her about it, and she said there was an issue with transport, but when I went to pick her up, she didn't answer the door. And the next day she asked me where I was.
I wonder what it's like for her to come to a core group meeting. What do core groups mean to her and Stephen?
Well, when I think about it, they are focused on the risks. So between the school talking about attendance and health talking about substance misuse and the revisiting of the plan and the risks, maybe they're just not very nice for them.
Tell me about the strengths. What's going well?
She's done well with the school. The EWO says the attendance is his problem to worry about, and she's worked well on home conditions. She's always there, she's really interactive, but it's a shame she won't come to the core group meetings.
It sounds like there are some positives here. Core groups are important to identify the risks, but it's equally important to identify what's going well for the family.
Yes, maybe I should think about having a chat with Mum and Stephen about making the meetings nicer and more accessible so that everyone's reviewing the outcomes of the plan and there's more reasons for them to come.
Let's think about this. There's been some positive changes for Mum. Something has led to some change. What do you think that is?
Well, I think the PLO was a wake-up call for her to realise that it wasn't just about Dad's behaviour. It was also about how she was caring for Stephen. She didn't have a great time as a child, so anything Stephen was getting was better than what she had. But during the CP visits, we spent some time talking about what she and Stephen wanted for his future and how they were going to be a family now. And she also heard Stephen saying things like he wanted to invite his friends round, but he couldn't because of the mess, and that he wanted to go to school every day, but he found it difficult to get up in the morning. And once he hadn't been on a Monday, it was more difficult to go on a Tuesday, and so on.
So it was important for Mum to learn what matters to Stephen?
Yes, we explored this and what she felt her role was, and she shifted a little.
What's helped her to do this? This sounds different.
We tried to focus on what the important things were to change at home. So in terms of risk, she could see why people were worried. She wants the best for Stephen, so we have a shared purpose, and we've taken things one step at a time. We're not there yet. But I need to help support Mum to see what else needs to improve, so that people become less worried, and Stephen can invite his friends round and go to school every day.
What are you most worried about at the moment? What are the priority risks?
Well, I think Dad is an unknown. Mum's attendance at the core groups does worry me, and Stephen's been on the register for so long.
I wonder if it's worth looking at that. Maybe thinking about a chronology.
We have got a chronology of dates of registration, drug use and so on.
Does it look at what the context was? So rather than just dates of registration or school attendance, but including what else was going on too. Identifying a pattern and what it looked like when things were going well.
No, not really.
What would they like to happen in the short, medium and longer term?
I could ask them that question. It could help clarify the priority risks, the strengths, and what needs to happen in the future to improve matters.
And think about what the family have found useful in the past and how they can best understand what we're worried about.
Yes, yeah, okay.
Yes, so you'll consider what the priority risks are. Dad and contacts, sustaining change, and your actions are to explore a little more, have those outcome-focused conversations with the family to help them identify what matters to them in the future. Should we update the assessment, do you think?
It might be an idea.
So, a child assessment and a chronology. Bring all the information together, speak to who you need to, look at the strengths and risks and good enough outcomes, and we'll go from there. Anything else about Stephen?
No, that's all.
Okay, who's next?